Falls and blood thinners, what's the risk? Blood thinners, also known as anticoagulants, play a crucial role in preventing strokes, especially for individuals with conditions like atrial fibrillation or venous thromboembolism. These medications work by reducing the risk of blood clots, but they also come with a heightened risk of bleeding. This is particularly concerning for those who are prone to falls. When someone on blood thinners falls, the risk of serious bleeding, such as bleeding in the brain, does increase. However, research indicates that the absolute risk of these bleeding events remains relatively low compared to the substantial benefits that blood thinners provide in preventing ischemic strokes and recurrent blood clots. In many cases, the reduction in stroke risk outweighs the potential for bleeding, even among older adults who may be more likely to fall. To navigate this balance effectively, healthcare providers recommend several strategies. First, it is essential to conduct thorough assessments to identify and modify any full risk factors. These can include issues like poor balance, muscle weakness, unsafe home environments, or medications that might increase the likelihood of falls. Regularly reviewing the need for continued anticoagulation is also important, especially for patients who experience frequent falls. Another key point is to avoid off-label dose reductions of direct oral anticoagulants or lowering warfarin targets to minimize bleeding risk. These adjustments can diminish the effectiveness of the medication without significantly lowering the risk of bleeding. Instead, healthcare providers should use validated risk assessment tools to weigh the risk of stroke against the risk of bleeding. This helps in making individualized treatment decisions that consider the patient's specific circumstances. Additionally, incorporating patient preferences and clinical context is vital, particularly for frail or elderly patients or those nearing the end of life. In these cases, the benefits of anticoagulation may not be as clear-cut. In conclusion, while falls can indeed increase the risk of bleeding for patients on blood thinners, the overall benefits of stroke prevention generally outweigh this risk. Careful patient evaluation and proactive fall prevention strategies are essential for safely managing anticoagulation therapy in individuals at risk of falling. This approach aligns with the current medical consensus, which emphasizes the importance of stroke prevention while balancing individualized risk management to minimize bleeding complications. Always consult with healthcare professionals to discuss specific risks and treatment options tailored to your needs.